Hello, family. Welcome to another episode of the Prescription for Better Living podcast. As always, I'm Dr. Hernando Carter, board certified internal medicine physician, your primary care extraordinaire. And welcome to episode 32 of the Prescription for Better Living podcast, where our goal is to discuss all things health and wellness in a hip and relatable way. Listen, we appreciate your support. We thank you in advance for subscribing to the podcast on YouTube, on Spotify, on Podbean. We thank you for sharing the podcast. We thank you for your likes, for your stars, for your comments. Keep that engagement up. And if you want to support the work that we do here, there are a few ways you can do that. You become a member of our Patreon family for just $1 a month. Visit us at patreon.com/Dr. Hernando Carter. You can hit us up on the Cash App. That's $PBL podcast. I appreciate that. You can call me and I'll pull up on you in the McDonald's or Milo's or whatever drive-through you want. I'll take that little change you got out your pocket. If you want to become an episode sponsor, a podcast sponsor, you can email us at contact@rxforbetterliving.org. You can see it there at the bottom of the screen, contact@rx4betterliving.org. Speaking of sponsors, major shout out to our foundational sponsor, Right On Time Physical Therapy, my man Cedric Cooper. Visit his website at rightontimept.com. Listen, you may be dealing with some shoulder pain, neck pain, back pain, knee pain, whatever. You're tight. You're an athlete. You're working out. You're getting that summer fine ready because it's January is coming and you hitting the gym and you're tight, muscles tight. Go visit Cedric Cooper. He can take care of all of your orthopedic needs. He can also help take care of your children. They have some issues you need to handle with physical therapy. You may have an older loved one. Maybe they're having some balance issues. They've been falling, or you see them walking and they look unstable and you're afraid that they may fall. Look, Cedric Cooper at Right On Time Physical Therapy can handle it. He is a certified licensed physical therapist. He is the owner and proprietor. And hey, this is a small business, Black-owned business. Go and support Right On Time Physical Therapy. They're right over there, Avenue D in Inslee, right at the Inslee Health Club. Tell them Dr. Hernando Carter and the Prescription for Better Living podcast sent you. If you want to support us, hey, you got a book, you got a small business, you got an event, holler at us. We can talk to you about being a sponsor. So listen, episode 32, we are continuing to talk about Medicare. So remember last episode, in episode 31, we started talking about Medicare and we gave you a history of Medicare. And you said, well, why was Medicare necessary? Well, because before 1965, seniors who had reached retirement age didn't have insurance. They were, for the most part, kicked off of insurance rolls because it was too expensive to provide care for them, according to the private insurers. And so what you had was that individuals reaching retirement age and they were losing their life savings, their retirement savings, trying to pay for health care. They were losing their homes, or they were going without healthcare. They were going bankrupt because of healthcare. This was a big problem. And so after many years of fighting the politics, medical industrial complex, fighting all of that, July 30th, 1965, we have Medicare. So let's get into it because, as I said last episode, a lot of people don't really know what Medicare is all about. They don't know the difference between Medicare and Medicaid, and they use those terms interchangeably, even though they're two totally different things. So we're going to get into it. So let's talk about Medicare's statistics. In 2022, 65 million Americans had Medicare. 65 million. Of that 65 million, 57 million of those Americans were 65 years old and older. So the vast majority. 8 million Americans with Medicare were younger people below 65. And this is all according to an annual Medicare trustees report. Medicare covers about half of the Medicare enrollees' expenses. And the enrollees cover the remaining cost. And we'll get into that because it can be expensive. So remember, we said before Medicare, 60% of Americans 65 and older had health insurance, which means 40% did not. And the cost of insurance back then was 3 times that it costs for an older person. But July 30th, 1965, President Lyndon B. Johnson signed into law Medicare as an amendment to the Social Security Act. So that is a recap. Well, let's get into talking about Medicare. Again, first of all, Medicare and Medicaid are 2 different things, all right? Medicaid is insurance for those individuals who are considered poor, all right? And I'm not talking about like just a little poor, right? I'm talking about poor. There are income requirements that you have to be a certain percentage above the poverty level to qualify for Medicaid. So you're talking about people who are very poor with Medicaid. Also, people who are disabled get Medicaid. Okay. But now let's think about this, because remember we said there are income requirements. You have to make below a certain amount. Okay. And we got the people 65 and older covered. But what about everybody else? Well, the majority of people get their health insurance from their employer. So as a benefit of their employment, their employer will pay a portion or all, but most places it's a portion of their premium for health insurance. And then the employee pays the rest through premium deductions from their paycheck, co-payments when you go to the doctor, co-payments for prescriptions, and then deductibles, right? Out-of-pocket stuff. Okay. But there are individuals out there who go to work every day and still can't afford or can't access health insurance. Who are these people? I'm glad you asked. They are small business owners who are self-employed, who may be a sole proprietor, or they have, in the truest definition of small business, a small business, they may have less than a handful of employees. They may be independent contractors, right? But in those cases, prior to the Affordable Care Act, it was too expensive for those individuals to purchase private health insurance on their own. You also have individuals who work every day, we call the working poor, who make too much money to qualify for Medicaid, but they can't afford health insurance to come out of their check. So they make too much money to get Medicaid, but private health insurance is too expensive for them to pay for, right? That's the working poor. So what do these people do? Well, I tell you what, before President Barack Obama and before the Affordable Care Act, they were up the creek without a paddle. Up the creek. Have you ever had to buy what they call Cobra insurance? So like, you lose your job, right? And they say, okay, you can buy some insurance, uh, uh, but it's gonna cost you more. That's Cobra. It's expensive, and it's still subsidized. What about people who just had to try to go out here and just buy it? They just couldn't afford it. The reason insurance is provided most of the times by an employer is because employers can bring in groups of people, right? They group you together. And because they group you together, you putting all your money into one pot, and you're going to have some people who are paying for insurance who never use it, never go to the doctor, never get a prescription, never go to the hospital. And then you're going to have some that use it more. But when you put it all together, it makes it more affordable, right? So that's why is most people get their insurance through their employer. Well, what the Affordable Care Act did was that it created what we call health exchanges. And listen, people were saying, just like we talked about the history of Medicare, people saying, oh, if Medicare passes, you had Ronald Reagan, the Denzel Washington of the time back in the 1960s. You had Ronald Reagan running around saying that if Medicare passed, it would be socialism, socialized medicine, communism. America would cease to exist as a free country, all this hyperbole. It passed, and we don't have socialized medicine. We're not a communist country. We're still a democracy. Well, they were saying the same exact, hey, they went into that same bag of tricks when we got ready to try to pass the Affordable Care Act. And they were saying the same thing. Well, listen, let me let you in on a little secret. The Affordable Care Act is not government controlled health care. All the Affordable Care Act did was make private insurance more available to more people by creating health insurance exchanges. So if an individual needs to buy insurance, now they can go sign up for an exchange, and what? They're like in a group now, right? Like a group of people. And so the insurance is more affordable. And that's why it's called the Affordable Care Act. So that's what happens in that case. But what about Medicare? All right. Oh, another distinction between Medicare and Medicaid is that Medicaid is administered by the states. Medicare is administered by the federal government through CMS, the Center for Medicare and Medicaid Services. Well, Medicaid is administered by the states. So the federal government sends down block grant money to each state, and then that state operates and administers the Medicaid program. And from state to state, Medicaid can be very different. If you're in the South, like we are in the red deep South, Medicaid programs are not very good. They don't have a lot of benefits. It's more difficult for people to qualify for Medicaid. They don't offer as many services. And then the reimbursement rate, what they pay doctors and nurse practitioners and physician assistants in hospitals, what they pay is very low. So much so that a practice could not survive if they had a large number of Medicaid patients. Actually, you lose money on Medicaid patients. You just do, especially in the South now is what I'm talking about. Now, up north and on the East Coast, Medicaid programs are more robust. The reimbursement rate, what they pay doctors and nurse practitioners and PAs, hospitals, is more. They're more closer to Medicare rates. They have more benefits for the Medicaid recipients, more programs. So there's a difference because it's administered by the states. And the states have to kick in some matching money, and your state can either kick in the bare minimum or they can really try to help their citizens, right? So that's Medicaid. Medicare, again, we said is administered by the federal government. Let me tell you one thing I love about Medicare. Medicare was passed July 30, 1965. What was going on in the 60s, y'all? Segregation, separate but equal, which we know is farcical. No such thing as separate but equal. You had segregated restaurants, segregated buses, segregated schools. Guess what else you had? Segregated hospitals. You had a few black hospitals right here in Birmingham, right over there in Ainsley. Holy Family had a hospital for black people. So you had a few. Up in DC, you had Howard Hospital, Howard University, right? But you had hospitals that blacks and whites had to go to, but they were segregated, separate floors. So you had white floors and you had black floors. You had, and I'm talking about floors of like first floor, second floor, third floor. You had separate waiting rooms, right? You think you were going to get your surgery, black person, in the same operating room a good white person had their surgery in? No, it was segregated, baby. And it was separate, but don't think it was equal. Don't think it was, you was in the nice wing. Nah. Well, Medicare roll around and they say, all right, we're going to pay for these people 65 and older for their health care. But guess what you got to do, hospitals? You got to integrate because we are America. And according to federal law, segregation is illegal. So it forced the integration of hospitals. Thank you, Medicare. Thank you. So let's talk about the cost of Medicare. In 2022, the Medicare spend was over 900 billion with a B dollars. Billion with a B. $423 billion came from the U.S. Treasury, came from the government, our tax dollars. Well, where did the other half come from, Hernando? I'm glad you asked. The rest, over $463 billion, came from us. Came from payroll taxes. It came from premiums paid by beneficiaries, from deductibles. Well, that can get expensive if you got these deductibles, right? So how do you pay for that? Well, some people, some people, they just had to do without. But then there came, and we're going to get into these breakdowns, there became something called Part C Medicare. There became Medigap insurance. And so let's get into that. So Medicare is broken down into 4 parts. And this is why I gave Medicare its own episodes, like 2 weeks, 2 episodes just devoted to Medicare. So I can make sure that my audience, my PBL family understood Medicare. So Medicare has 4 parts. A, B, C, D. Easy to remember, right? 4 parts. Medicare Part A covers hospitals, skilled nursing facilities, so nursing homes, and hospice. So Part A, think on the top, think the first thing, think the most expensive care, Part A. hospitalizations, hospice, nursing home. Okay. Got it? Bet. Part B, think secondary B. Next, outpatient stuff. So office visits when you go to the doctor, outpatient services, your outpatient procedures, colonoscopy, stuff like that. Part B. Let's skip to D because D is very important. Part D, think drug. D covers prescription drugs. So Medicare did not always cover prescription drug costs. It was not until President George W. Bush, George W. Bush, that we got prescription drug coverage through an amendment to Medicare. Medicare Part D covers drugs. Then you got Part C. Now, this is the one that can get tricky. Part C is like what they call now your supplemental. It's like you could pay extra to get coverage for all the stuff that traditional Medicare doesn't cover. And then now the big word you're going to hear is Medicare Advantage. Okay. Medicare Advantage, y'all, listen, it's just the private insurance companies now get money from the federal government to administer Medicare, right? So Blue Cross Blue Shield has a Medicare Advantage plan, Viva, United Healthcare, Cigna, Aetna, Devoted. These are all private companies that get money from CMS to now administer Medicare. Well, these insurance policies are a lot better for patients in a lot of regards because there's less out of pocket. So the things that traditional Medicare, when I say traditional Medicare, have you ever seen someone with a traditional Medicare card? It's just like a red, white, and blue Medicare card. Look like your Social Security card. Whereas someone with a private Medicare plan is going to have something that looks more like your private insurance card, right? So Medicare Advantage now covers more. They cover your drugs. They cover your hospitalization. They cover your doctor's visits, your procedures. They even will provide transportation to and from the doctor appointments and procedures. A lot of them have nutrition benefits, so help provide money for groceries. Over-the-counter benefits. So some medications that you need to buy over the counter instead of paying cash out of your pocket, insurance pays it. So this is Part C or Medicare Advantage. So we got Part A, Part B, Part D for drugs, and Part C, or A, B, C, D for Medicare. Now, here's the deal. People say Medicare, Social Security, going broke. Don't believe it. Can't go broke. You know why I can't go broke? Only way to go broke is they stop collecting taxes from us. Now, I've been paying into Medicare since I know at least 1995, 1996, because I had my very first job. I was 16 years old, Arby's. And I remember I went working, baby, working. And I got my check, my first check, Gary. And I said, well, this ain't how much, because I had tabulated it. You know, so back then, I was getting minimum wage, right? Minimum wage, Gary, was, what is it now, 7.25, I think. 7.25, I think, minimum wage. Back then, it was, when I started, like 4.10, 4.15. Then I remember it jumped up to 4.25. Woo, when it jumped up to 5 and 5.25, baby, we was rolling. But that first check, I'm minimum wage, but I'm working. I've been getting my hours, right? And I'm thinking I'm finna have some money. And I looked on that pay stub And it was a lot less than I had calculated in my brain. Well, you know what I ain't account for? FICA, FICA. And I said, Mama, who is FICA? And why they took so much of my money? So Medicare ain't gonna run out of money because FICA is cutting, and you think they were cutting me in, baby. I'm a doctor. They cutting me now. So FICA, payroll taxes, investment in the treasury. And then, like you said, Medicare is only paying half of the annual cost. We paying the rest, okay? So it's not gonna go bankrupt. A lot of people are proponents for Medicare for all. So they say, hey, why we just letting Medicare be for those 65 and under? I mean, 65 and older. Why don't we just open it up to everybody? They can get their insurance through Medicare. And then you would have it set up where you would have public option and a private option. But let me tell you something about how America works, y'all. All these people who are saying that health insurance, if we get a public option and Medicare for all, we're going to go to single payer and the government's going to be in control of health care. No, they won't. Let me tell you something. Health insurers are major employers all around this country. Think about how many people that work for the insurance company. It's a lot of jobs all over this country in all 50 states. You have people that are a part of the medical industrial complex who work for health insurance companies. Who is going to let a whole industry now, private insurance, private health insurance is an entire industry. So that would be like saying you're going to let the entire automobile industry close down. And we know they ain't going to let that happen because the federal government already bailed out the automobile industry, right? He said how much you need, and they got all the money, baby. So they're not going to let the private insurance industry collapse. You see what's going on now? What's going on now is that Medicare, for the most part, is administered by private insurance company. The federal government gives Blue Cross, Viva, United Healthcare, Cigna, Aetna, all of them, Humana, money to actually run the insurance program for the beneficiaries. They're not going to let, I promise you, we are not in danger, nor will we ever be in danger of having single payer health care like they do in Europe or anywhere else because it's too baked in. You would kill too many jobs. That is political suicide. So get that out your head. Get that out your head. So remember, you can have Medicare right now if you're 65 and older. Remember, I said the majority, 57 million Americans are 65 and older, but there are 8 million who are under 65. Those are people with disabilities, right? Particularly if you're disabled, like end-stage renal disease, you have to go on dialysis, cancer, you are disabled. You can't work. You get Medicare once you are qualified as disabled. Now, here's the deal. There's a 2-year waiting period, though. You don't get labeled disabled and then boom, all of a sudden you get Medicare. Oh, no, no, no. They make you wait 2 years before you can get Medicare. So what do those people do if they're disabled, they're not working? So they give you an option. They say, okay, you can buy Cobra, but you're not working. You got your disability check coming in now. But hell, you've been spent all your disability check up on damn Cobra. And then they say, okay, well, you can get Medicaid. Remember, I said it's not a good program. It doesn't pay much. It's very hard to get. A lot of doctors don't take it. So before the Affordable Care Act, those people were disabled, and a lot of them didn't have insurance for 2 years. Now think about it. You're medically disabled, but you don't have a way to pay. All right. Fortunately, the Affordable Care Act came, and again, it allowed people to go and buy health insurance on the health insurance exchange. Okay. And that made it more affordable for those people who were in that gap waiting period. So listen, I know this was very complex. This ought to be the episode where the comments ought to be lit up, because you should have follow-up questions for me. You should be DMing me with questions. You should make me do a follow-up live to explain some of this stuff, because I know it's complex, right? Fortunately, hey, this is recorded. You can go back and watch it as many times as you want to. If you're in the gym and you're driving, you can't watch, hit us up on Spotify, Podbean, still free. You can listen to it as many times as you want to, so we can break it down. But I wanted to explain to you, carve out a couple of episodes to explain to you about Medicare and Medicaid. In subsequent episodes, we're going to get into talking about our healthcare system and how the health insurance actually works, right? And how your care is delivered and how your care is reimbursed, all those kind of things. So we're going to get into that. But this has been another episode of the Prescription for Better Living podcast. As always, I'm Dr. Hernando Carter, board certified internal medicine physician, your primary care extraordinaire. Hey, shout out and thanks to our foundational sponsor, Right On Time Physical Therapy. Visit my man Cedric Cooper, rightontimept.com. He's also on Facebook, Right On Time Physical Therapy. Check him out. We're going to do some shoots from Right On Time so you can see what their facilities look like. Hey, you know what I want you to do? Wherever you go, whatever you do, spread the good news. Stand on the tallest mountaintop you can and scream, hallelujah, Dr. Carter is here. Until next time, Dr. Carter saying,